Hi, I'm Dr. Gary Cow, and I work with the Tricity Pain Associates. I'm here in our Corpus Christi location where we see patients for acute and chronic pain. Today we're going to talk a little bit about sciatica, pseudosciatica, and lumbar reticulopathy. So really, anytime someone comes to my clinic and has with chief complaint of pain running down the back of the buttock or down into the leg, into the foot, commonly people think that's just sciatica, but in truth, a lot of times that's a misnomer, particularly if this person also has lower back issues. So sciatic nerve actually is comprised of several of the spinal nerve roots coming from the lumbar spine that converge in a location approximately here and become one of the largest nerves in our body. And it goes down the back of the butt, down the back of the leg, and then branches from there to form some of the other nerves that give sensation and motor control to the rest of that appendage. However, many times the problem doesn't exist here where the sciatic nerve forms and begins to exist, but actually higher up, and the problem actually lies in the spine. For example, a very common pathology that we see is herniated discs. That can also be called a protruded disc, a disc extrusion, or even disc degeneration. So what ends up happening is we have these bones in our spine called vertebra. In between, we have something called the intervertebral disc. And that provides cushioning, that provides a strength via flexibility in every segment of our spine. However, sometimes with age that becomes degenerated. This may be compounding factors from multiple injuries throughout someone's lifetime. And if that disc becomes compromised, we may have a herniation, which is demonstrated here just in this model. Now this is just a facsimile, probably a little bit dramatic, but hopefully illustrates the point that it can cause nerve irritation, which this is a nerve root coming from the spinal cord. And having that nerve irritation or inflammation in that region can cause neuropathy, nerve symptoms, shooting pain, burning pain, things running down the back of the legs. These are all considered something of the same family of syndromes that we treat.